Good morning for the next 5 minutes. I want to bring the House Health Committee to order. And if, Devin, would you please take the roll?
Chair Frankel.
Here.
Representative Benham.
Here.
Borowski.
Here.
Boyd.
Here.
Fiedler.
Here.
Khan.
Here.
Kozarowski.
Designation.
Krajewski.
Here.
Mays.
Here.
McAndrew.
Designation.
Friel-Loudon.
Here.
Sanchez.
Designation.
Schusterman.
Designation.
Venkat. Chair Ratt.
Here.
Representative Bonner. Borowitz.
Here.
Brown.
Designation.
Kiefer.
Here.
Rossi.
Here.
Rowe.
Designation.
Schemmel. Stair.
Designation.
Twardzik.
Here.
Zimmerman. We have quorum.
Thank you. The first item on our agenda this morning is House Bill 1963. Is there a motion to consider House Bill 1963? Representative Khan moves, second by Friel-Loudon. Representative Friel-Loudon. This legislation states that spouses of veterans will not be charged for certificates for vital records. This clarifies existing law, which specifies veterans and dependents will not be charged, but did not specifically name spouses. Chair Rapp is offering an amendment to House Bill 1963, Amendment A04472. Emily, would you like to explain the amendment, please?
Thank you. Amendment A04472 explicitly lists whose vital statistics records are eligible for the fee waiver, including the spouse of a predeceased veteran, and who is eligible to apply for a fee-waived certified copy of these records. This is done to address the ambiguity regarding fee waiver eligibility in the current law. Additionally, the amendment limits the number of free certified copies an applicant can receive per year and per record to 10 copies. This codifies the Department of Health's current policy for death certificate records. It is our understanding that this is an agreed-to amendment.
Are there any additional comments? Madam Chair?
Thank you, Mr. Chairman. I want to thank both Representative Delosier and Representative Pillay for this bill. First of all, I do think it is a good bill. The amendment will insert language from Representative Delosier's bill, House Bill 2083, and the amendment not only seeks to address the same issues as in Representative Pillay's, I hope I pronounced the... Thank you. But it restores the fee waiver for death certificates issued for spouses of predeceased veterans. It also rewrites the records section, it also rewrites the section of the Vital Statistics Law to outline what vital statistics records are eligible for the fee waiver and who may apply for those records. It codifies current Department of Health policy to provide 10 free death certificates, and the amendment was drafted in consultation with the Department of Health, and it's my understanding that they are in agreement with the amendment. And I want to thank both representatives for addressing this very important issue. I would ask for a yes vote on the amendment. Thank you, Mr. Chair.
Thank you, Madam Chair, and this is an agreed-to amendment. Are there any negative votes on the amendment? Seeing none, A04472 is amended into the bill. Is there any discussion on House Bill 1963 as amended? Yes?
Sorry, never mind. No, we're fine.
Okay.
That someone to move the amendment? Okay, apologies.
Oh.
Ask if there's someone who would move to consider the amendment.
Oh, sorry. Sorry about that. We have to do the formality of going to move the amendment. Representative Khan moves. Representative Borowski seconds. Thank you. And any negative votes on the amendment? Seeing none, amendment is adopted. Thank you. And I said, didn't see any other discussion on House Bill 1963. I want to thank the prime sponsor and my co-chair for work on this bill. I know my office has received phone calls related to the change in policy related to death certificates, and I know the Department of Health is happy for the clarification in language so that they can continue to provide this service. Are there any negative votes on the bill? Seeing none, House Bill 1963 is reported affirmatively out of the House Health Committee. Thank you very much. Next up is House Bill 2127, prime sponsored by Representative Fiedler. Is there a motion to consider House Bill 2127? Representative Krajewski, second by Representative Mays. Thank you. This legislation creates an education and screening program for perinatal mood and anxiety disorders, which is commonly referred to as perinatal depression, but can encompass more than just depression. The legislation states that the Department of Health must create a resource and education sheet about perinatal mood and anxiety disorders, and that the resource sheet must be provided prenatally and at delivery. Additionally, patients must be screened prenatally, at delivery, and postnatally by their midwives or obstetricians for perinatal mood and anxiety disorders, and pediatricians must screen mothers as well as baby visits and share information with patients' providers. Representative Fiedler will be offering Amendment A04496. Erica, would you please describe the amendment?
Amendment A04496 refines the process for screening and education about perinatal mood and anxiety disorders. It clarifies that providers are responsible for screening prenatally, postnatally, and at well baby visits. Hospitals and birth centers are required to provide information about perinatal mood and anxiety disorders at delivery. The bill fixes language, ensuring that patients are invited to fill out questionnaires but not required to, and ensures patients receive the health questionnaires in their primary language. Finally, the amendment creates a requirement for an awareness campaign from the Department of Health related to perinatal depression in order to reduce the stigma surrounding the illness. I do want to make one note. There is a typo on page 2, line 5 of the amendment. Inadvertently, it was listed as plural. LRB has acknowledged the word psychiatrist. It should be psychiatrists, not psychiatrists. LRB has acknowledged the error, and they are going to be fixing this when it's drafted into the bill. So rather than getting a corrective reprint, they just said that we could acknowledge that verbally, and that will be fixed.
Okay. Is there a motion to adopt the amendment? Representative Borowski, second by Representative Venkat. Thank you. Is there discussion on the amendment? Chair Rapp.
Thank you, Mr. Chairman. I'm going to oppose the amendment at this time, and after the bill's amended, I will speak further about the bill. I do applaud Representative Fiedler, for bringing this issue to the forefront, and but I will be explaining and comments on the bill after it's amended.
Any additional comments? Devin, will you take the roll, please?
Chair Frankel?
Yes.
Representative Benham? Yes. Borowski? Yes. Boyd?
Yes.
Fiedler? Yes. Khan?
Yes.
Kozarowski?
Designation, yes.
Krajewski?
Yes.
Mays?
Yes.
McAndrew?
Designation, yes.
Freelouten?
Yes.
Sanchez?
Yes.
Schusterman?
Designation, yes.
Venkat?
Yes.
Chair Rapp?
No?
Representative Bonner? No. Rep Borowitz?
No.
Brown?
Designation, no?
Kiefer?
No.
Rossi?
No.
Rowe?
Designation, no?
Schemmel?
No.
Stair?
Designation, no?
Torzik?
No.
Zimmerman?
No.
1411 passes.
Thank you. The amendment A04496 is amended into the bill. Is there discussion? Do you want to describe the bill as amended? Okay, all right. Discussion on the bill. Just, okay. Chair Rapp? you want to close or should we?
Pardon?
Someone else wanted to speak first. Do you want to do it
I'm gonna
last?
let
Did somebody else?
Representative Fiedler.
Representative Fiedler, did you want to speak before or after me? I'll defer to you.
I would be glad for you to go first
Okay.
if you would like to. Thank you.
Thank you, Representative, and thank you, Mr. Chairman. Representative Fiedler, I know you've worked hard on this bill. I appreciate the work that you and the staff have put into it, and I also want to thank you for reaching out to me on this bill. That certainly means a lot when a member will reach out to a chairman to discuss the legislation. And I do welcome discussing bills with Democrat colleagues, and I also welcome that discussion. Postpartum depression is a valid concern, and I believe your bill has merit. I am hopeful that on the floor I can vote for your bill, but as currently drafted, I am voting no. While I believe that 2127 has a laudable goal, I do have some concerns. This bill would create another mandate for healthcare providers, and as many of our provider groups emphasize, screening for postpartum depression is already best practice. As I have heard many times over this past several years, practitioners should not be overly burdened with mandates, but rather should have more flexibility when dealing with patients on an individual basis. I'm concerned with the lack of access, which you and I discussed, to care in many parts of our Commonwealth, and this bill would not be able to adequately address what it purports to do. Screenings can only do so much if a patient cannot get in to see a practitioner in an adequate amount of time. As to the bill itself, I believe there are remaining deficiencies that the amendment has not fixed, and hopefully they can be fixed before it goes to the floor. Some terms are undefined. Nurse is not defined in the bill, yet the resource information and screening requirements apply to nurses. Does this bill include all nurses or just specific types of nurses? Also, while the bill defines midwife or nurse midwife, it does not apply to midwives. Is this intentional or simply an oversight? Practitioners are required to ask pregnant women and mothers to complete a postpartum mood and anxiety disorder questionnaire, but the bill does not specify what kinds of questions are being asked. This gives me some pause. While I'm not a medical expert, I do have concerns with a pediatrician being tasked with reviewing the questionnaire that was filled out by the patient, in quotes, in accordance with the clinical practice guidelines. What guidelines does this reference? Is it the guidelines that a pediatrician follows? If so, are they in the best position to do this, or is that better served with the patient's primary care practitioner or the OB/GYN? What are current postpartum mood and anxiety disorder clinical practice guidelines as specified in the bill? The definition for clinical practice guidelines was removed, and as such, I wonder if the guidelines are uniform across specialties or if they differ depending on who is seeing the patient. And that brings up another one. I'm concerned that we now have a PROTS issue. As you may know, based on Pennsylvania Supreme Court precedent, the General Assembly is prohibited generally from delegating something to a third-party entity where the government has no oversight. By simply providing that clinical practice guidelines be used, we are now delegating this responsibility to outside entities who can change those guidelines without our input or input from a state agency through the regulatory process. I believe we now have a legal issue with the way this bill is structured. The Department of Health is tasked with enforcing this bill, yet there's no mention of what happens in the event of a violation. There are no penalty provisions in this bill, and further, the bill affords no oversight of practitioners to the state boards. What happens if a physician is found to have violated this bill? Will the Department of Health refer a matter to this applicable state board? Even if the department does this bill does not specify that violations by a practitioner are considered violations of a Medical Practice Act. So our state boards are powerless under this bill. There are no provisions for how this issue is to be addressed. Representative Fiedler, as I mentioned earlier, I would like to support, and I think the members would like to support your bill, but I hope to be able to do so on the floor. However, without further amendments addressing these concerns, I'm not able to support your bill at this time. And I know there was a lot of back and forth with amendment discussion with our executive directors. I will be voting no on House Bill 2127, but I'm hoping that the bill can be amended to address some of these issues. But I applaud you also for your efforts. So thank you, Mr. Chairman.
Thank you, Madam Chair. Representative Fiedler.
Thank you, Chair Rep, and thank you for your remarks and your words. I hope we can get to that point. I wanted to ask Erica, if you're able to, there were a lot of questions in there. I hope we can answer them, maybe not all today, but if you can answer specifically, Erica, regarding the details on the questionnaire. I know that was a concern, where that material would come from. And specifically, can you just give us clarity on the landscape in Pennsylvania right now? I believe that was one question that Chair Rapp asked, and it seems very important to me. My understanding is that providers believe that screening is a valuable practice, and many do it now, but we don't know if all of them do it. So if you could just give us a snapshot of what we do know about perinatal and postpartum screening that's already happening.
Absolutely. And looking forward to working with your executive director on this issue going forward. I will say that as far as the term of art used in there, it's validated screening tool. That's what's often used by the professions. And for example, postnatally, I think the preferred one is the Edinburgh Postnatal Depression Scale. It's 10 depression scale. It's 10 questions with information about scoring. There's also something called a PHQ-2. I can't remember what that stands for, but that's another tool that's often used prenatally, and it's just 2 questions about feelings. So there are a bunch of different tools out there, and one of the things the prime sponsor didn't want to do was to specify what clinically, if it is considered a clinically valid tool, what tool the provider must use, given that they might want to use a different tool for a different patient. So rather than specify and capture something, permanently, to give some variety there, but definitely looking forward to working with your executive director on that. Regarding data around people using these clinically validated tools right now, we don't know exactly. One good thing that Pennsylvania does is within our managed care organizations, within our Medicaid program, we actually have this as considered to be a very important indicator in terms of how well the managed care programs are doing in taking care of the patient population. So perinatal depression screening using a validated depression screening tool is one of the things that we measure these plans for. Additionally, screening prenatally, screening postpartum, and also screening during the time frame of the first 2, that's prenatal care visits, sorry. So prenatally and postnatally. So we are tracking that, and unfortunately, it's kind of across the board. So once again, these are providers who are incentivized to do this screening. They are given they're rewarded by the MCOs because the MCOs are judged by our Medicare, our Department of Human Services on this. It's 73% is the mean for postpartum. It varies. Some plans are as low as 60% of people are getting screened. Some are as high as 83. During the prenatal care visit, it's much lower. It's actually 56% is the mean. And some plans are as low as under 40% of people are getting screened, and then some are as high as 70%. So there is wide variation. Once again, this is for patients who are receiving care and their care is being paid for by medical assistants. Within the commercial insurance market, we don't really know, and we don't know that those plans are actually giving value-based payments for this kind of screening. So we don't have the ability to either understand or really know that that's being prioritized.
Thank you. I do have comments I would like to share when the discussion's over, but that answers my questions. Thank you, Erica.
Thank you. Representative Free-Lawton.
Thank you, Chairman. Looking around the room, I think I might be one of a handful of folks who have actually spent some time in postpartum care in the last decade and have experienced the screening for postpartum depression and experienced the experience of being a postpartum parent. We know that welcoming a baby should be a joyous time for every family, but the reality is, especially now, that a new baby can mean sleepless days and nights, isolation from friends, anxiety about stretched finances, missed career opportunities, physical hormonal changes that trigger postpartum depression, and that can change over any given amount of time. So you may be screened at your postpartum appointment with your OBGYN, and you may feel fine, but 2 weeks later when you take your child to the pediatrician, you may be feeling differently because all of those things are constantly in motion in the months following giving birth. The chairwoman mentioned the lack of access as a concern, and I share that concern, and that's why I feel this legislation is so important, because we should be taking every opportunity to intervene that we possibly can. And a lot of times in families where a mother has to go back to work, my second born, I had to go back to work 2 weeks after I gave birth. When you're going back to work and you don't have maternity leave, you may not have time to get your postpartum appointments in with your OBGYN, and you may be prioritizing your baby's appointments with their pediatrician. We have extensive research that shows that the maternal bond and the relationship between a mother and child has extreme impacts on early childhood development and long-term cognitive and mental health development for children. And therefore, we have a responsibility in both the OBGYN's office and in the pediatrician's office to ensure that both mother and baby are being cared for properly, to ensure proper care for mom, and also proper interventions for baby if they are required. We recently passed legislation on the floor that would expand early intervention services to children of mothers who are diagnosed with postpartum depression. And in order for that to be successful, we need to be ensuring that we are educating parents and doctors, and we are creating opportunities for those interventions. Thank you.
Representative Mays.
Thank you, Chair. May is maternal mental health month, and as we raise awareness about the impact of mental health during pregnancy and in the postpartum phases of childbirth, we also are working to eliminate stigma and shame and isolation associated with this experience. Above all, we want to connect those who need these types of services where as quickly as possible, as soon as possible. As a new parent of a 9-month-old baby, I can tell you that depression before, during, and after childbirth is real, that intervention is necessary, and that our whole goal is to support and ultimately to save moms from a preventable path of maternal mortality and morbidity. So increasing access to mental health treatment and services, I hear us saying the same thing, that we want to do that we want to increase these types of services. And it is important, it was so important to us outside of our Momnibus bill, the Black Maternal Health Caucus recommended that we create a perinatal psychiatric access program that could help supplement the capacity of frontline workers to provide services, mental health services, to those who want to provide mental health and respond to their patients in a timely fashion. And so currently Pennsylvania is one of 21 states that does not have an active or aspiring program. I share all that to say that this makes this bill, House Bill 2127, that much more important to advance out of our committee as a part of the Pennsylvania Momnibus, which is on the move. So I welcome my colleagues to please get on the bus and I urge a yes vote on House Bill 2127.
Thank you, Representative Mays. Representative Borowitz.
Thank you, Chairman. We just, Republicans, I think, just do not agree with the forced screenings. It's forced by a government and mandated screenings on moms. But I am very grateful this morning in this, meeting that Democrats are referring to mothers and babies. And so I'm very grateful for that. Prenatal, postnatal of a child, a baby in the womb. So I'm very grateful to hear those things, though. So, but yes, no forced screenings on moms. Thank you, Chairman.
Thank you. Representative Borowski.
Thank you, Chair. I don't think I can say it any more eloquently than my prior two colleagues said. But what I will say is that it is our responsibility to make sure that no one falls through the cracks. And right now we know that there is a void. There are cracks. So this bill, I think, helps to address that. And I would urge my colleagues to vote for it. I don't think that it is forced. I do believe that the legislation states it is not necessarily mandatory, but it is something that I think can certainly save lives. We know healthy moms lead to healthy babies and healthy families.
Thank you. Representative Venkat.
Thank you, Chair Frankel. Certainly, as a health professional, I share the concern about government mandates and the potential for legislation to fall behind the latest evidence on these issues. But I think that there are a couple points that need to be made as to how this legislation has changed through the amendment that makes this a very positive step forward. The first is that at the perinatal stage, the screening that is done is to make sure that mothers are aware of the potential for postpartum anxiety and depression. In my experience as a physician, many are not, because we presume that it will automatically be viewed as a joyous occasion, and that the potential for not being aware of this leads to the second issue, which is that typically after a woman has delivered, they would not see their OBGYN for up to 6 weeks after that delivery. And so it is only in the infant and newborn situation would there be the potential to intervene when postpartum depression and anxiety can become most manifest in the first 2 to 4 weeks postpartum. And the bill has changed such that in the pediatrician's office or the family physician's office or the psychiatrist's office, it is a request to the mother to screen. It is not a mandate. So I think the concerns about mandated screening are misapplied with the way the bill has been structured. So I was very proud to work with the prime sponsor and with the chair on these issues, and I will be a yes vote and urge others to do the same.
Thank you. Representative Khan.
Thank you, Chair. I just want to thank my colleague, Representative Fiedler, for this bill. I, too, am a healthcare provider, and I think any way we can intervene to make sure that we're addressing the mental health issues of our patients help us to ensure that we're delivering safe and effective care. I think, I'm a healthcare provider who sees babies, and because we have prenatal and postnatal care, we have OB at our health center, a lot of times I'm not seeing the mother, but I'm seeing the baby. And any way we can find ways to make sure that we're capturing any red flags, I think we need to go for it. We ask providers to do other things that they have to do. We make sure that providers are washing their hands. We're making sure that they're wearing gloves when they're handling bodily fluids. If there's isolation precautions on the patient, provider has to follow that. So I think asking a provider to do a simple preventative screening is not beyond the realm of what should be expected for healthcare providers. And again, as a healthcare provider, I welcome that additional intervention to help make sure that my patients are getting safe and effective care. So thank you again, Representative Fiedler, for your bill. I think it's important that we move this along. Thank you.
Thank you, Representative Khan. Representative Fiedler.
Thank you, Chair. Good morning, chairs and colleagues, and thank you for considering House Bill 2127. I'm truly grateful to my colleagues on both sides of the aisle who have provided feedback, and I look forward to working together to improve this bill even more. I would like to share just a few facts with the committee, facts that many people I've talked to have found shocking. At least 1 in 7 new moms struggles with perinatal or postpartum depression. 1 in 7. It sets in during pregnancy or in the first year after giving birth. It is, in fact, the most common complication for women who have just had a baby. Postpartum depression shows up in different ways, but generally can include strong feelings of sadness and anxiety, insomnia, hopelessness, and feelings of worthlessness, shame, guilt, and fear. That's a lot for a new mom, on top of learning to change diapers, wrap a swaddle, and feed a new baby. There is science behind this condition. It is not entirely understood, but believed that the drop in estrogen and progesterone after a woman experiences birth may contribute to this condition. It is shocking to me that the stigma around mental health struggles of new moms remains so heavy, even as the stigma of mental health overall, thankfully, has been diminishing. Our society expects new parents to be filled solely with happiness and joy. There is certainly great happiness and joy when a baby is born, but there is often much more. Sadly, there is often little time or desire to talk about depression. That is the bad news, but I would like to share that this piece of legislation provides, hopefully, a bit of good news for moms who are struggling across Pennsylvania, because with greater awareness and diagnoses, there is hope. Recovery can feel impossible for many of these new moms, but with therapy and sometimes medication, women usually recover. Postpartum depression is not a character flaw or a weakness, but for many women, in the midst of this struggle, it can feel that way. Half of women diagnosed with postpartum depression never experienced depression before in their life. That part feels especially important to me because many of these women who are struggling simply do not have the words to describe the condition that they are facing. They have fear and they have deep feelings, but they don't have the words to even tell their medical provider. I would also like to see an increase in providers to treat this condition and would welcome the opportunities to support or work together on legislation to do that, both in urban, rural, and suburban areas across our Commonwealth. I do not believe that a shortage of medical providers to help these women should be a reason that we would withhold a medical diagnosis from any patient. We would be withholding vital medical information from new moms, a diagnosis that could save their life. When I came into office 5 years ago, I was determined to help new moms in Pennsylvania who are experiencing postpartum depression. My baby is not quite as young as Rep. Mays is, but 10 years later, 10 years, the postpartum experience is still vivid in my mind. This legislation would help many new moms put a name to their struggles and hopefully get help. I would be grateful for your support on this bill. I look forward to working together as this bill heads toward the House floor. Thank you for your support of new moms and their babies.
Thank you, Representative Fiedler, and thank you for all your work, and also to the Black Maternal Health Caucus for all their work on this bill, some of whom my colleagues have been active from this committee. Most moms who die by suicide do so after 7 weeks postpartum, beyond the point when a postnatal appointment might take place. That's why experts recommend screening take place at well baby visits, which continue long after postnatal appointments. We also know that great treatments exist, so identifying people with perinatal mood disorders means they can access the care, whether it's a pill to rebalance hormones or therapy or both, that they will get that they need to get them well. I understand that nobody likes mandates. That's why I'd like to applaud the midwives for coming out in support of this legislation, even though it creates an extra mandate for them, because they know how important this care is for patients and for their babies. I would hope that all providers would stand alongside them to call for the best for patients. With that, I would ask for a roll call vote. Devin?
Chair Frankel.
Yes.
Representative Benham. Borowski.
Designation, yes.
Boyd.
Yes.
Fiedler.
Yes.
Khan.
Yes.
Kozrowski. Krajewski. Mays.
Yes.
McAndrew.
Designation, yes.
Freelouten.
Yes.
Sanchez. Schusterman.
Designation, yes.
Venkat.
Yes.
Chair Rapp.
No.
Representative Bonner.
No.
Borowitz.
No.
Brown.
No. Designation, no.
Kiefer.
No.
Rossi.
No.
Rowe.
Designation, no.
Schemmel. Stair.
No.
Twardzik.
No.
Zimmerman. 1411. Passes.
Thank you, members. House Bill 2127 is reported affirmatively as amended from the House Health Committee. Thank you, members. We now have a group of non-controversial resolutions, and without objection, I move that we consider them as we have in the past as a whole. The resolutions are as follows. House Resolution 419, introduced by Representative Cutler, designates May 2024 as Amyotrophic Lateral Sclerosis, or ALS, Awareness Month. House Resolution 432, introduced by Representative Gatos, recognizes April 2024 as Parkinson's Disease Awareness Month. House Resolution 433, introduced by Representative Maligari, recognizes May 17, 2024 as World Neurofibromatosis Awareness Day. And finally, House Resolution 440, introduced by Representative Sapita Freites, recognizes May 2024 as Mental Health Awareness Month. Is there a motion to consider the package of resolutions? Representative Rapp, Chair Rapp, and Representative Schemmel seconds. Are there any negative votes on the resolutions? Seeing none, the resolutions are reported from the House Health Committee. One other piece of business we have in front of us today is Senate Bill 739, which we are re-referring to the House Insurance Committee. This bill passed out of the House Banking and Insurance Committee in the Senate, and the Insurance Committee has traditionally handled the questions related to insurance coverage of telemedicine. Is there a motion to re-refer? Representative Freelotten, second. Representative Kiefer. Are there any negative votes on the re-referral? No? No. Seeing none, Senate Bill 739 is re-referred to insurance. If there's no further business, this meeting is adjourned, and I thank everybody for their attendance and participation. Thank you.